What's going on, everyone? Happy Thursday. Hopefully everyone is doing well, staying safe, healthy, having a great day so far, and I really hope you are testing negative for all those viruses, including COVID. It is time now for the Thursday edition of the Virus Update for Thursday, August 28th, 2025. If you are new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of viruses out there, and you need to be informed of what's going on with those viruses, both here in the United States and all around the world. That's what I do here on my channel each and every day. Want to stay informed? Just subscribe down below. If you like today's video, give it a thumbs up and hit that notification bell. And of course, leave your comments down below, and ways to support the channel, such as Patreon, are listed down below. Hey, that helps keep the website running. It helps keep me going. Alrighty, starting off with this from Dennis the COVID Info Guy. We got several things to take a look at today in the news department. It's actually a pretty busy news day, which is why I stopped doing research and said, you know what, let's just record. So here we go. New South Wales respiratory surveillance reports week ending August 23rd, 2025. The COVID positivity rate in New South Wales is 3.9%. That's actually up by 0.2%. So yes, they are starting to go up a little bit once again. COVID, 3 out of 4 laboratories are reporting 1,516 COVID cases reported. That's, again, up by 3.1%. So COVID, it went up there a little bit this week. Influenza, 6,728 new cases. That's down by 9.1%. Good news there. RSV, 1,497 new cases. That is down by 5.4%. When it comes to COVID variants in New South Wales, the NB.1.8.1 is now at 73% of the cases. XFG, still only at just 12% of the cases. KP.3, 10% of the cases. JN.1, 4% of the cases. And LP.8.1 is just 1% of the cases. And we do see that there are reports on wastewater, and it looks like only one area went up, another was stable, and 2 were dropping at this time. Hunter and Liverpool did drop at this time, which that is good news to see some dropping. But again, their COVID was up ever so slightly this week. Alrighty, did not want to put this as the first news story because I'm sure it would scare some people away from watching the rest of the video. I know, COVID vaccines are not a very well-liked topic, but I got to give you this news. I don't always like to include vaccine-related news in my videos, but something such as this, which I do get a lot of comments about, or here and on social media, I figure we might as well share this. FDA approves new COVID shots with limits on who can get them under RFK Jr. Yeah, some like them, some don't. We won't go there, but it's going to be 65 years and older, so I'll just raise my hand right now and say I'm not 65 years old. I am 35 years old. Well, now you know my age. I'm 35 years old, but I do have asthma. I don't know if that's going to qualify me for the new booster if I should choose to get it. Again, it's up to you. If you want to get it, fine. If you don't, that's your prerogative. That's the way I'm looking at it, because we get both sides of the aisle here when we do these videos. We get those who want it, those who say don't get it, then the other comments in between. So yes, just know that boosters have been approved if you're 65 years and older, or you do really have some immunocompromised condition or something like that, where you're not healthy, and you will be able to get it. But for those who are healthy, you're not going to, unfortunately, this new guidance says no booster for you. Okay, moving on. Arkansas health officials warn of West Nile spread. Yeah, this is a problem. We've been seeing West Nile virus pop up in various different places in various different states. Arkansas is the latest one. Also saw a story yesterday, did not include it. A place we check for EMS data, Pinellas County, Florida. Yes, that may be an issue down there as well. We got a few cancellation notices. Yes, if you're going to see a show, maybe you're not, because illness is running around. Billy Idol and Joan Jett, you know, rock genre. Banger concert, this is up in Maine, has been canceled due to, yep, you guessed it, illness. They are dealing with illness at this time. I believe it's Billy Idol Aerosmith, one of the members from Aerosmith, who is out, I guess, touring. Aerosmith icon Joe Perry was forced to cancel multiple concerts due to an illness he is currently battling. Yep, illness. It's really running around. Looks like he was supposed to do a show at a Foxwoods Casino in Connecticut. And moving on to this, George Clooney abruptly backs out of Venice Film Festival appearances over, quote, illness. Now, in all three of these cases, we don't know what the illness is. Sometimes we find out down the line it was the flu, it was COVID, it was something else. I'll be keeping an eye out, and of course, all three of these, including George Clooney, will include that as well, in the, things being canceled or celebrities dealing with illness at this time. Yeah, that's 3 additions that I'm going to have to make today. Yikes, things are not going well. All right, in Hawaii, we have more news. Measles virus is being detected at a wastewater sampling site. Now, I checked over on Wastewater Scan. I was not seeing it there. Over on the CDC page where we check flu, COVID, and RSV, there's more wastewater sites, though. That has not updated. And I wish the CDC had a measles wastewater page. They don't, as far as I know. If anyone knows of one, let me know down below. I don't think they have. It wouldn't be up to date anyhow, but the point is, the few sites listed over there on Wastewater Scan are not showing us. But yes, they are keeping an eye out for this. And of course, we'll keep an eye to see if this leads to any new reported cases. Speaking of measles, here's the United States measles update. And it looks like this is as of when? August 26th, 2025. There are a total of 1,408 confirmed measles cases were reported by 43 jurisdictions in the United States. Hey, we're only just a few away from that 50 mark now. That's not good, and I don't think we're done penciling in states. I feel we're going to have a few more states yet to come. I mean, we just saw, where was it, Alabama this week. Here's some of the demographics. Under 5 years old, 393% of the cases. 5 to 19 years old, 531 cases. 20 plus, 477. Age unknown, 7 cases. Unvaccinated or unknown, that's 92% of the cases. 1 dose of vaccine is 4%. 2 doses is also at 4%. All right, UK update. Kind of a mixed picture here. I'll start you off with the good news. Cases are down there this week. 1,381 cases, down by 119. Deaths, 41, down by 2. It looks like healthcare is up slightly, but I don't know if that number up top, that 819, I don't know if that actually updated. It does say increased by 22. The positivity rate, this is a little bit of bad news. At one point in between last week's report and this week's report, it did hit 9%. If we come down here, we can see it did drop back below 9%, but again, it did hit that 9% at one point. Maybe more people got tested. Let's see. We can see, I'm pretty sure we can view PCR testing, people receiving the test. Oh, that's dropping as well. That might have been why it jumped up so much. All right, moving on now. Let's see what the viral activity levels are in Canada. The wastewater viral activity level for COVID-19 is moderate. Flu A is low. Flu B is low. And RSV is listed at low at this time. Air qualities are still a problem in the West Coast. You'll see this as this loads. You'll see the wildfires are still an issue out there. Take a look at that. Yeah, some reds, some maroons, oranges. Not a good thing to see. Also, the east is okay, except for the southeast. There are a few yellow issues there. All right, continuing on now to Pinellas County, Florida, where there have been a slew of calls today, and you do see sick person is listed at least 3 times right now. It was listed 4 or 5 times earlier, so yeah, that is still a thing. In Philadelphia, 818 EMS incidents on Tuesday, 794 EMS incidents listed for Wednesday. Current EMS calls in Montgomery County, Pennsylvania, just 11 right now. That's not bad. I did see several ambulances this morning. Let's take a look at Chester County. Yikes, now this is not good. We do see respiratory emergency listed not once, not twice, not 3 times, but 4 times. And remember, let's go back for a second. Air quality is not bad here, so that is relatively concerning. We are also seeing sick person call listed here as well. Let's take a look at Bucks County, Pennsylvania. You can see there was 11 calls earlier. What is there now? Hey, just only 3 calls. That is good to report. Taking a look at what's going on with the hospital situation, a little bit of an increase today in the number of hospitals dealing with a problem. We can see 3 in the Lehigh Valley, 1 in Southeast PA, 1 near Reading, and 1 near Gettysburg, but I don't think that Gettysburg one has updated. No, that still says August 25th. Taking a look at what is going on in New Jersey, and we can see Inspira Medical Center, Malka Hill, has a full and total divert for patient volume, and University Hospital has a psychiatric issue at this time. Taking a look at what's going on with New Jersey's respiratory report for this week, there continues to be an increase in emergency department visits associated with COVID-19 in recent weeks. Emergency department visits do, however, still remain low. Though low, there has also been an increase in hospital admissions for COVID-19. The majority of hospitalizations have been reported in 65 years or older. Test positivity is elevated for COVID and a few other viruses. Levels of COVID-19, influenza A, influenza B, and RSV in wastewater are still low in New Jersey, though we've seen some increases on wastewater scan. The predominant COVID-19 variant is XFG, a subvariant of Omicron, covered by COVID-19 vaccines. Respiratory outbreaks recently reported in long-term care facilities are due to COVID-19. New York State, don't have that Thursday number in yet for New York City. Let's refresh this. Maybe it came in. Now, don't have it. We'll get that into tomorrow's update, and then we'll probably do the Friday numbers on Saturday. Does that make sense? We're recording a little bit early today. 510 new cases reported yesterday. Mind you, we did not show you yesterday's numbers. Taking a look at the hospitalizations in New York State, 406 people hospitalized, 38 in the ICU. That hospitalization number did drop ever so slightly, so that is at least some good news to report. All right, let's take a look at some numbers now from CJS, and then I think we will end on just a little bit of wastewater data today. But before we get to this, I got to remind you of something. Labor Day weekend is coming up this weekend. A lot of people will be traveling. Maybe you're flying, taking a train, or maybe you're just going by car. No matter how you do it, you are going to interact with the public. Be mindful. We are still in that summer COVID surge, and these numbers will prove that we are still in the summer COVID surge. Now, some numbers from CJS 83172. But before we do that, let's pause and take a hydration break, shall we? Today's drink of choice is juice. Alrighty, starting off with some numbers from Tuesday, Florida. The daily case count there, it was still high. 1,963 new cases and 1 new death. Again, that's still a high case number. New York State, they finally went back and corrected themselves, at least here. They didn't correct that dashboard. It still doesn't show the missing cases, but there was a big case dump on Tuesday, and obviously that's because of the fact that there was some sort of an error going on. 3,650 new cases, including that data dump, which is responsible for much of that increase. Puerto Rico, daily number on Tuesday was 1,378 new cases and 5 new deaths. Maryland, a weekly number of 1,244 new cases, a slight decrease from last week. 126 CDC reported hospitalizations from last Friday's update, and 6 new deaths. Virginia, now, I believe this is an increase. Virginia, 3,613 new positive tests, 3,433 just from the week of August 17th through the 23rd. 152 CDC reported hospitalizations from last Friday's update, and 6 deaths reported by the CDC data tracker. Florida, daily number, 3,201 new cases. There may or may not be a case dump involved. Wow. If there's no case dump, that would be a big increase. If there is, that explains why it's up. Nonetheless, still a lot of cases coming out of Florida. And a net of 10 new deaths. 1 death. I don't know where Florida keeps getting these deaths from, but they keep finding them from previous years. 1 death from January of 2021. Okay, in this case, was removed from the state's accounts, and there were 11 new deaths from recent weeks added. Yeah, I don't know why they just said, oh, that wasn't COVID. Why are they even going back to check that? I guess they have to make sure everything is up to par. New York, daily number, 534 new cases. That's more like it for a daily. number from New York. But again, remember, New York State undercounted there for a while, and that's why that Tuesday number was so high. Puerto Rico, daily number, 1,244 new cases. Oregon, weekly number, 315 new positive tests. Washington, weekly. Yikes, you did a lot of emergency department visits. 875, and this is the state of Washington. 875 emergency department visits and 5 new deaths. Washington COVID-related hospitalizations, per the CDC, may be posted on Friday. Then he says, of note, while Maryland's case count decreased a little from last week, the same cannot be stated about its southerly neighbor, which saw a 20% jump this week. Also, with the 6 deaths, Maryland reported this week the total number of state-reported COVID deaths, 18,791, combined with the 2024 U.S. Census population estimates for the state, 6,263,220, means that the total deaths per capita for Maryland hit 3,000 per million. Note, Maryland is one of those states where CDC shows a significantly higher COVID death count than what the state shows. Yeah, there's several states where it may be the COVID deaths or maybe the hospitalizations. They just don't match what the states show. That is a thing. I will never understand why that is, but 2 different counts. Maybe not everything gets reported to the CDC, or in some cases the CDC reports things higher than the state. I honestly don't know. All right, it is a holiday weekend coming up. Many people are going to start their travel tomorrow. Be mindful. Take a look at this. I mentioned it before. We are in a wave, and you can clearly see that on this map. When we're in a COVID wave, it's noticeable by the color of this map. And there is orange showing up across the board here on wastewater scan. High levels in the west, the Midwest, the Northeast, and the South. So let's do one wastewater site from each region. Stamford, Connecticut, what's going on there? Well, take a look at this. Most recent updates show medium. However, COVID has increased her. Let's go to somewhere in the South now. And how about we come down to Tallahassee, Florida? Now, this may be chopped off data. Okay, it is, but you can still see at the end here. Yeah, it was rising for August, so they are continuing to see a COVID rise there. Let's go to somewhere out on the West Coast, shall we? How about we come out to California? I want to go down San Diego. We can't go to San Diego. Why? Because San Diego is grayed out at this time. We can see here the westernmost portion of Los Angeles. 4 million population. This is a big population. And yet we are seeing medium for COVID, and it is slightly starting to trend upward at this time. That's not good whatsoever. And now let's go over to the Midwest, shall we? How about we take a look at what is going on how about we go over to Northeast Lincoln, Nebraska, and see what's going on there. COVID at this time, high, and wow, really continuing to rise there. I do wonder, do you have any norovirus issues? No, you do not. That's something else I want to show you. Be mindful of this. COVID is not the only virus out there right now in the United States. There are a few areas you can see here. Each region has some areas that are at least at medium or moderate for norovirus at this time. And then there are some orange areas showing up that are high for norovirus. Here's one in North Carolina. Kinston, North Carolina is really high for norovirus at this time. Also, take a look at this. COVID, it does continue to rise there at this time. Alrighty, folks, that does it for the Thursday edition of the Virus Update. We will have another update again tomorrow. I don't know what CDC data is actually going to update this week, but we will have an update nonetheless. Of course, if you're doing anything tomorrow or this weekend, please be safe, especially if you're going to those concerts. 3 illnesses. I think that might be in today's title of the video. If you enjoyed today's video, give it a thumbs up, subscribe down below, hit that notification bell, share this video with anyone you know, leave your comments down below. Ways to support the channel, such as Patreon or becoming a member of the channel, are listed down below. Alrighty, folks, I will see you again tomorrow. Until I see you again tomorrow, stay safe, everyone. Have a fantastic Thursday afternoon. Thanks for watching.